The pinch hitter has arrived.
Will invite you again to another season.
I would love to.
Bring a friend.
Fernando Stein, good to meet you. I represent the American Academy of Pediatrics. Really? Thank you. Thank you. We're happy to be here. I've heard that we're representing something shy of 60% of physicians in the nation here today. Six organizations, to be exact, 560,000 physicians we're representing. Very concerned about the bill, as you can imagine.
It's your guy. Yeah. It is. That's it.
We are so glad that you are here. We are so glad you are here, and we have not given up.
American Psychiatric Association.
I'm Boyd Boozer, I'm the president of the American Osteopathic Association.
My goodness, we have all these distinguished people.
Nice to see you again, Fernando Stein from the American Academy of
Thank you.
Pediatrics.
It's good to see you again. Yes, hi.
Hi, Jack Lady, American College of Physicians in Internal Medicine.
Excellent. Well, thank you for being here. I guess Senator Hassan and I are speaking, and you're speaking
Dr.
on
Stein is
behalf
speaking too, so
of the group? Yes.
Yeah.
No, I think
okay. I think I'm good.
Okay, well, let's bring everyone up. This is an impressive group.
Yeah.
Good afternoon. I feel healthier with all of these experts here today, and we're very grateful for your dedication and all of the people that you represent. And I want to thank Senator Maggie Hassan, who is here with me as well, a passionate advocate on health care, and we're very pleased that we have so many people that are with us. Dr. Fernando Stein will be speaking in a moment, the president of the American Academy of Pediatrics. But let me also just introduce Dr. Michael Munger with the American Academy of Family Physicians from Kansas, and Dr. Jack Endave, American College of Physicians from Pennsylvania, Dr. Hayward Brown, American College of Obstetricians and Gynecologists from North Carolina, Dr. Renee Bender, American Psychiatric Association from California, and Dr. Boyd Boozer, American Osteopathic Association from Kentucky. Did I miss anyone? Great. Well, as I said, we are extremely pleased to have people with us, and even though yesterday we had some temporary good news, we know that the Senate majority is still focused on passing a bill that will raise costs for all Americans, that will lower the health care coverage and medical care for many tens of millions of people. And the great insult of this whole debate is that the savings being used will be giving a tax cut for wealthiest few Americans, which does not represent real American values, certainly in my judgment. So, thank you. Yes. Thank you. And I also want to say in starting that the Senate Republican majority began the day after we were sworn in on January 4th to undercut, repeal the current healthcare system. And they originally anticipated, they said they were going to do this by January 27th. It is well past January 27th. And the reason this has not happened is because of leadership of the physicians and hospitals and nurses and activists, people who advocate for cancer patients and Alzheimer's patients and our children, the disability community, working with all of us in the Senate and the House to say no. And so far, the reason we are where we are and there is not a vote today, as they had anticipated, is because people across the country know that this is personal. Healthcare debate is not political. It may be being addressed as a political exercise. We all know in our hearts and souls, this is not about politics. This is about people. It's about our families. This is personal. And so yesterday, the Senate Democrats stood on the Capitol steps and showed pictures. We have we have
there's
some
a
behind
lot of
us,
behind
many that we held up. I want to mention Amy from Royal Oak, Michigan, right here, small business owner who has leukemia. She has a $20,000 a month medication bill. Very quickly hit her her out-of-pocket costs because of the Affordable Care Act. She is able to get her medicine, is able to get the care that she needs, and of course, as someone with a pre-existing condition, is terrified about what will happen along with the ability for her to get her treatment. And we have stories that we held up on the Capitol steps, and we know that these are the people that we are fighting for. Under what's being called Trumpcare, this would really take us back to the days when the insurance companies were in charge instead of the doctors that are with us now. Your number of cancer treatments would not be determined by your doctor. It would be determined by the insurance company. And we know what happened when, in the past, prior to patient protections, someone could get sick and then get dropped from their insurance or have very limited ability to get the care that they need. We also know at that time, while you could get a cheap policy, and Republican colleagues talk about the fact that people have a right not to have these burdensome rules like the requirement to have maternity care or the retirement requirement to actually cover something, that prior to that time when insurance companies actually had to cover something and doctors were the ones making decisions, you could get a very cheap policy. I called those junk policies, and as long as you never needed it, it was great. But if you got sick, my office would get a call saying, what do you mean they'll only cover 1 day in the hospital? What do you mean I can't get what I need? So those were not the good old days. Those were the days when people were not covered and didn't get the help they needed. So this essential health care benefits that we've said, the basics for people under health insurance, which Republican colleagues again call burdensome regulations, basically say prescription drug medications to treat and prevent illnesses should be covered, maternity care so that being a woman, it does not amount to a pre-existing condition. If you want to have a baby, mental health and addiction services, even hospitalization and a trip to the emergency room. There's basics that you should know are covered if you are purchasing insurance. Without this, we know people will pay thousands more out of pocket, and we will actually see less care. And finally, before turning this over to my wonderful colleague, Senator Maggie Hassan, let me stress the fact that what they are doing to Medicaid health care, first of all, has nothing to do with the private market. They debate whether or not costs are too high in the private market. There are costs too high. Count us in. Prescription drug prices too high. Count us in on fixing that. There are people with out-of-pocket costs that are too high. We want to focus on that. None of that relates to Medicaid, where states are actually saving money by people getting out of the emergency room for things that could be done in the doctor's office. Michigan's going to put $432 million more into the state budget this year because uncompensated care in the emergency room is down by 50%, meaning people aren't walking in without insurance to be able to pay for the bill. And we celebrate that 97% of the children in Michigan can now see a doctor. So doing the right thing is actually saving money. What our colleagues, unfortunately, are doing is wanting to take those funds to pay for a tax cut. So if we want to talk about real ways to improve healthcare, count us in. You want to take away people's healthcare to pay for a tax cut, which for the top 400 people amounts to $33 billion collectively? Count us out. And that's really what the fight is about. Again, this is personal. This is not about politics. We are greatly appreciative of the people that are with us today and all those that they represent. Senator Maggie Hassan.
Well, thank you to Senator Debbie Stabenow, who is a terrific voice for her constituents in Michigan and just been a terrific leader on this issue. I also want to thank all of the advocates and the various physician groups who are represented up here today. You're all on the front lines, and you're doing critical work as we continue to debate the future of our nation's healthcare system. And I'm reminded with all of you here, I'm the granddaughter of a pediatrician and my mother, growing up in the 30s and 40s in his household, remembered that starting at about 7 o'clock in the morning, he would, as he shaved and got breakfast, move the phone from room to room and plug it into a different phone jack because the calls would start coming in. And she just remembers all the advice given to usually mothers of children who had the stomach bug overnight. And the advice always ended with no butter on the toast. And it is a reminder, too, though, of a simpler time in medicine and a reminder that we have much to celebrate in the developments that our medical community, our research community have brought us, the lives that are saved, the quality of life that so many people today have, even though they have chronic illness and disability. It's also a reminder of what is at stake. I want to just also start with pointing out two photos here because there are two Granite Staters here. Carla in the red jacket and Bodie in this wheelchair. We heard from Bodie's mom at our emergency field hearing on Friday in New Hampshire. Senator Shaheen and I had an emergency field hearing. The reason Bodie, age 3, has that phenomenal wheelchair is because of the Affordable Care Act, because when her insurance company told her that it didn't need to pay for a wheelchair, she knew that the Affordable Care Act had said that was not the case. And so she called back and she advocated, and Bodie, you should see him handle that amazing wheelchair. Carla's story is about the importance of Planned Parenthood, and I just don't want people to forget that the Trumpcare bill that is still being considered would defund Planned Parenthood. And because of care that Carla got from Planned Parenthood when she was 19 years old and a college student without the funds to afford health care, the debilitating pain that she had that was caused by ovarian cysts that would have caused her to drop out of school, that was treated, and she got better. And she not only went through college, she clearly has a family now. So that is the power of access to health care. There's a reason you see so many physicians here from so many different specialties. These doctors know firsthand that Trumpcare is really bad for America's health. Yesterday, after trying to push through dangerous legislation that would be a disaster for the people of New Hampshire and millions of Americans, Republican leaders decided to delay the vote on Trumpcare. It was and is the loud and passionate voices of Americans speaking up, calling their senators, and describing how Trumpcare would impact their lives. That's the reason why we're not voting on the bill this week. But make no mistake, Trumpcare is not dead yet. The decision to delay the Senate vote does not change the fact that under Trumpcare, Americans would pay more for worse health care coverage, all in order to give billions of dollars in tax breaks to corporate special interests, including Big Pharma, at the expense of hardworking Americans and the programs they rely on. This is the basic principle of Trumpcare, and it is unacceptable. The various versions we've seen of Trumpcare would make things worse for most Americans. whether you currently get your insurance through your employer, whether you buy it individually, or whether you have Medicaid. If you buy your own insurance, you could have to pay more for your coverage. Trumpcare establishes an age tax, which would be especially harmful if you are between the ages of 50 and 64. Trumpcare would allow states to get rid of the requirement that they must cover important patient protections. These essential health benefits, ones Senator Stabenow talked about, include maternity care, prescription drug coverage, and coverage for substance use disorder services. Trumpcare also ends Medicaid expansion, which in New Hampshire has provided 50,000 hardworking Granite Staters with quality, affordable health coverage in a bipartisan Medicaid expansion plan. And experts have said our bipartisan Medicaid expansion is the #1 tool they have to combat the heroin, fentanyl, and opioid crisis in my state. In addition to ending Medicaid expansion, Trumpcare would cut and cap the Medicaid program, which forces states to choose between slashing benefits, reducing the number of people who can get care, or both. That would impact children, pregnant women, seniors who need home care or nursing home care, and people with disabilities. And Trumpcare would continue Republican efforts to roll back access to critical health services by defunding Planned Parenthood. We know the Affordable Care Act isn't perfect, but Trumpcare is not the answer. It's time for Republicans to come to the table in order to improve the current law, build on the progress we've made, and lower health care costs for all of our citizens. I'm willing to work with any of my colleagues on bipartisan solutions in order to make that happen. While my Republican colleagues have delayed a vote on this bill, this fight is far from over. And I'll keep working to ensure that Trumpcare never becomes law. I urge you all to keep up your efforts. Please do not stop opposing this bill. People have to keep calling, sharing their stories, making your voices heard, and your priorities heard as well. You know, Bodhi's mother told us on Friday that he was about a year old when he got his diagnosis for a particular and rare kind of muscle degeneration. And she was with her husband in the hospital as they were getting the news. Her husband isn't from the United States. He's from, I think she said, Nepal. And he held her hand and said, you know what? This is tough, but at least we're in America. He'll get health care. That's what this is about. We're a democracy where everybody counts. And we can make sure that everybody gets health care. Thank you.
Thank you.
And Dr. Stein.
Yes, Dr. Fernando Stein, American Academy of Pediatrics. So it's Mr. President.
Thank you.
That's a nice ring.
Yeah. Thank you, Senators. Good afternoon. I am a pediatrician from Houston, Texas. I've been practicing pediatrics there for the past 40 years, and particularly in the field of critical care in the front lines of pediatrics. Today, I'm honored to speak on behalf of 560,000 physicians in the nation. That's shy of 60% of the physicians in the United States. There is 1 million physicians in the country, and the 6 organizations that are represented here account for 560,000, as I said. We are here with the American Academy of Family Practice, the American Congress of Obstetrics and Gynecology, the American College of Physicians, the American Psychiatric Association, and the American Osteopathic Association. Our organizations represent the nation's frontline physicians who provide the overwhelming majority of care to our nation's children, pregnant women, adult, elderly, and the full range of physical, mental, and behavioral conditions. Each day, the physicians we represent provide health care to patients in communities large and small, urban and rural, and rich and poor. Our members see real-life consequences of being uninsured and underinsured. They witness real-life choices people have to make when their deductibles are so high that healthcare, despite their insurance coverage, is beyond their reach. Every day, our physician colleagues guide their patients through the best and the worst moments of their lives. Today, we're in Washington to stand up and speak on behalf of our patients. We are here to express our strongest opposition to the Better Care Reconciliation Act. If enacted, this legislation would cause millions of people to lose their health coverage, including people with employer-sponsored insurance. It would permanently undercut the Medicaid program, negatively impacting healthcare coverage and access to care for millions of children, pregnant women, and seniors in nursing homes. It would allow states to opt out of vital market reforms and consumer protections such as essential health benefits, prohibitions on annual and lifetime caps, and meaningful protections for people with pre-existing conditions. And most troubling, it would financially punish older, sicker, low-income adults, the very people who need the security of health insurance the most. In 1965, at the signing ceremony of the Medicare and Medicaid programs, President Lyndon Johnson stated, "Many men can draft many laws, but few have the piercing and humane eye which can see beyond the words to the people that they touch. Few can see past the speeches and the political battles to the doctor over there that is tending the infirm and to the hospital that is receiving those in anguish, or feel in their heart painful wrath at the injustice which denies the miracle of healing to the old and to the poor. But it is just such men who illuminate the life and the history of a nation. The bill before the Senate fails to meet this standard. Our healthcare system is not perfect, and there are reforms that should be pursued, especially those that reduce the cost of healthcare for individuals and families. We should all commit ourselves to pursuing public policy that improves people's lives, or in the words of President Johnson, policies that see beyond the words to the people that they reach. Our organizations stand ready to work with the administration, the United States Congress, governors, and state legislatures to identify and implement such policy. But first, we must abandon the bill that is before us. In closing, a vote for the BCRA is a vote to knowingly and deliberately harm millions of people. We implore the Senate, do no harm. Thank you very much.
Thank you very much. Thank you so much, Representative. Thank you, Dr. Stein, for that powerful statement. And I also want to give a special shout out to the Michigan chapter of American Academy of Pediatrics and their president-elect, Dr. Sharon Swindell, who has been here in Washington as my guest, speaking out, and has also been in Michigan, a very powerful voice speaking out for children and families. So we thank everyone for being here. We'd be happy to take any questions. All right. Well, thank you very much for being here. We appreciate it. So.
Thank you so much. Thank you on behalf of my colleagues.